Hello, welcome to part 33 of Clinical Physiotherapy MCQ series. Here, we will be discussing day-to-day clinical scenarios with detailed explanation. Now let's move to question number 161. A physical therapist administers an upper limb tension test with radial nerve bias to a patient positioned in supine. Which action would be the first to occur? Option A, depression of shoulder girdle. Option B, extension of the elbow. Option C, lateral rotation of the shoulder. Option D, flexion of the wrist. And the answer is option A, depression of the shoulder girdle. Explanation to this question is upper limb tension test requires ordered sequence of movements occurring at the hand, wrist, forearm, elbow, arm and shoulder. Depression of shoulder girdle is the first action that would occur when performing the upper limb tension test with radial nerve bias. Now let's move to question number 162. A 59-year-old male patient is being evaluated for left shoulder pain. The patient reports that his shoulder pain is closely associated with activity, including stress at the work. The patient reports that at the worst, the pain radiates into his neck and he feels shortness of breath which subsides with rest. What would be the most appropriate intervention be? Option A, begin passive range of motion exercise within the pain-free range of motion. Option B, postpone treatment and refers the patient to his physician for further evaluation. Option C, apply modalities to the shoulder and instruct the patient on activity modification. Option D, begin the patient with rotator cuff exercises within the pain, reduced range of motion and instruct the patient on activity modification. And the answer is option B, postpone the treatment and refer the patient to his physician for further evaluation. Explanation to this question is option B, this is the most appropriate initial action. The patient is having signs of cardiac distress that would be worsened with the activity. Option A is wrong. Passive range of motion is an excellent treatment for sore shoulders, but the patient is presenting with signs and symptoms consistent with cardiac distress, not musculoskeletal pain. Option C is wrong because this is not appropriate considering the above information. Option D is wrong because the pain is not originating from the rotator cuff, thus this would be the poor choice. Now let's move to question number 163. A patient present to outpatient physical therapy clinic with severed ulnar nerve in the upper extremity. What muscle is still active and largely responsible for obvious hyperextension of the metacarpopharyngeal joint, that's MCB joint of involved hand? Option A, dorsi interossei. Option B, volar interossei. Option C, extensor carpi radialis brevis. Option D, extensor digitorum. And the answer is option D, extensor digitorum. And the explanation to this question is an ulnar nerve compromised hand presents at a claw hand after a prolonged amount of time because of the atrophy of interossei. The extensor digitorum takes over and pulls the MCP in hyperextension. Now let's move to question number 164. A 34-year-old male rehabilitating from a motorcycle accident is brought into a clinic for gait training. The patient sustained a fractured tibia. The patient is partially weight-bearing and has good upper extremity strength. What is the most appropriate assistive device for the patient? Option A, walker with platform attachment. Option B, axillary crutches. Option C, loft stand crutches. Option D, crane. And the answer is option B, axillary crutches. Explanation to this question is axillary crutches would be the most appropriate assistive devices to accommodate the patient's weight-bearing status. Axillary crutches are used to support a patient when one leg is almost entirely non-weight bearing and should be used for short-term purpose while the patient is recovering. Now let's move to question number 165. A patient with 10-year history of Parkinson's disease has been taking levodopa, that's L-dopa, for the last 5 years. He presents in your clinic with disorienting function. He is not longer able to transfer or walk independently. During the oral interview, you observe facial grimacing with twitching of lips and tongue protrusion. He appears restless. with constant dancing, etude-like movements of his leg. Your best course of action is to Option A. Complete your evaluation focusing specifically on his main problems of rigidity and bradykinesia. Option B. Document your observation and refer him back to his physician for evaluation of possible dopamine toxicity. Option C. Talk to his wife to see if he is taking any drug with hallucinogenic effects. Option D. Use isokinetic dynamometry to assess his inability to generate torque output during fast movements. And the answer is Option B. Document your observations and refer him back to his physician for evaluation possible dopamine toxicity. Explanation to this question is dyskinesia, involuntary movements, are a common side effects of dopamine toxicity, as are gastrointestinal disturbance, that's nausea and vomiting, and mental disturbance, restlessness, general overactivity, anxiety or depression. While the symptoms described in the other choices may also occur with Parkinson's disease, they do not accurately explain the presence of adventurous or involuntary movements. So that's all for today. If you have any doubts, please mention in the comment box. For further learning, keep in touch with the channel. See you in the next part, that's part 34. Bye bye, see you. Thank you for watching.